Now today's presentation is part 3 of nursing practice questions and answers about gastrointestinal problems. Now let's start with the first question of part 3. The nurse is reviewing the prescription for a client admitted to the hospital with a diagnosis of acute pancreatitis. Which interventions would the nurse expect to be prescribed for the client? Select all that apply. Option A, maintain NPO status. Option B, encourage coughing and deep breathing. Option C, give small, frequent, high caloric feedings. Option D, maintain the client in a supine and flat position. Option E, give hydromorphone intravenously as prescribed for pain. Option F, maintain intravenous fluids at 10 ml per hour to keep the vein open. So the correct answer for this question is options A, maintain NPO status, option B, encourage coughing and deep breathing, and option E, give hydromorphine intravenously as prescribed for pain. The client with acute pancreatitis normally is placed on NPO status to rest the pancreas and suppress gastrointestinal secretion, so adequate intravenous hydration is necessary. Because abdominal pain is a prominent symptom of pancreatitis, pain medications such as hydromorphone are prescribed. Some clients experience lessened pain by assuming position that flex the trunk with the knees drawn up to the chest. A sidelining position with the head elevated 45 degrees decreases tension on the abdomen and may help ease the pain. The client is susceptible to respiratory infections because the retroperitoneal fluid raises the diaphragm, which causes the client to take shallow, guarded abdominal breaths. Therefore, measures such as turning, coughing, and deep breathing are instituted. Now let's move to the second question. The nurse is reviewing the laboratory result for a client with cirrhosis and notes that the ammonia level is 85. Which dietary selection does the nurse suggest to the client? Option A, roast pork. Option B, cheese omelette. Option C, pasta with the sauce. Option D, tuna fish sandwich. So the correct answer for this question is option C, pasta with the sauce. Cirrhosis is a chronic, progressive disease of the liver characterized by diffuse, degenerative, and destruction of hepatocytes. The serum ammonia level assesses the ability of the liver to deaminate protein byproducts. Normal reference interval is 10 to 80. Most of the ammonia in the body is found in the gastrointestinal tract. Protein provided by the diet is transported to the liver by the portal vein. The liver breaks down protein, which results in the formation of ammonia. Foods high in protein will be avoided since the client's ammonia level is elevated above the normal range. Therefore, pasta with the sauce will be the best selection. Question 3. The nurse is doing an admission assessment on a client with a history of duodenal ulcer. To determine whether the problem is currently active, the nurse will assess the client for which manifestation of duodenal ulcer. Option A, weight loss. Option B, nausea and vomiting. Option C, pain relieved by food intake. Option D, pain radiating down the right arm. So the correct answer for this question is option C, pain relieved by food intake. A frequent symptom of duodenal ulcer is pain that is relieved by food intake. These clans generally describe the pain as a burning, heavy, sharp, or hungry pain that often localize in the mid-epigastric area. The clan with duodenal ulcer usually does not experience weight loss or nausea and vomiting. These symptoms are more typically in the clan with a gastric ulcer. Question 4. A clan with the hiatal hernia chronically experience heartburn following meals. The nurse will plan to teach the clan to avoid which action because it is contraindicated with the hiatal hernia. Option A. Lying recumbent following meals. Option B. Consuming small, frequent bland meals. Option C. Taking H2 receptor antagonist medication. Option D. Raising the head of the bed on 6-inch blocks. The correct answer for this question is option A. Lying recumbent following meals. Hiatal hernia is caused by a protrusion of a portion of the stomach above the diaphragm where the esophagus usually is positioned. The clan usually experience pain from reflux caused by ingestion of irritating foods, lying flat following meals, or at night and eating large or fatty meals. Relief is obtained with the intake of small, frequent, and bland meals, use of H2 receptor antagonist and antacids, and also elevation of the thorax following meals and during sleep.